So the biggest question is, what's the health of the eggs when you freeze them? And
that's a great question.
If we have 3 to 4 months usually before egg freezing, we have the capacity to really impact egg quality in a big way. So that even if you're freezing your eggs at 38, which is not necessarily what they would recommend, but if you're at 38 and you're like, hey, I finally have the funds, I want to freeze my eggs.
Right, so expensive.
I mean, I still don't have a man. I want to freeze them till I'm ready.
You better make sure you're putting away good ones.
Yeah, exactly. So then at 38, we spend the 3 to 4 months to do whatever we can to support egg quality, get it to optimal before freezing eggs.
I'm Riley Rees. This is the Sofia Unfiltered podcast, where we bring together thought leaders, wellness entrepreneurs, makers, and emerging health leaders. We're here to have raw, unfiltered conversations because sharing your stories has the power to change lives, help others heal, and transform the way we take care of ourselves. Here we go.
Welcome back to Sofia Unfiltered. I'm Riley Rees, and today we're picking up where we left off with Dr. Simmons. If you haven't listened to part 1 yet, make sure to check it out for our deep dive into women's health and fertility. Here we go. So, so we have this holistic, we have the test we can do to come into you, we're going to get healthy. What happens? How long do we go through this process realistically? And maybe, like you said, the quote unquote age makes the difference, but like, at what point do you bring in that conventional, we'll call it just drugs and options?
Yeah. So it's a balance between the age of the woman, because as much as we don't care about age, IVF clinics very much care about your age. And like I've had, there was a 44, 45-year-old that we find, like I had worked with her for a while. She had a ton of hormone issues. So it took a while, right? She came to me at 42. I worked with her for 2 years. Finally sent her to the IVF clinic because she was a solo mom by choice. And she goes in for her IVF cycle, and I prepped her. I was like, they're going to like shame you and guilt you into like, why didn't you do this sooner? What's wrong with you? You know, like it's just all going to come at you. Just be ready. So she went in like, I want to do this. I want to do it now. Right. And they were like, oh, you're too old. We're not doing this. Da, 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 da. She's like, I don't care. Just do it. And
they will take your money, right? Because they may shame you. But they're taking
some clinics, like if they're a respectful clinic, they're gonna really question whether they should or not. So it's good that they question it. The clinic that we like to refer to is awesome.
Which one is that, by the way?
We like Spring Fertility, and they're in the Bay Area and New York. Okay. So they have two. They're bi-coastal.
Okay.
So they questioned all of it, and then they went ahead and did her cycle. Her retrieval, they got 23 eggs, 18 of them fertilized to grade A.
And everybody listening understands that if you get 1 or 2 good eggs, it's a miracle.
At 44, yeah. So all of the nurses in the clinic were like watching her and were like, what did you do? What have you been doing with her? I'm like,
you can call Dr. A and figure it out yourself. Exactly.
Yeah, there's a lot that we've been doing. And they were like, no, this is just impossible, like unheard of.
Yeah.
And I'm like, maybe, like maybe I don't really do IVF. I have no idea. But what I know is that if we set up the body
for success.
Yes. If we set up the right conditions for the body to be successful, then it's going to surprise you.
And did she have a baby?
A good surprise. Oh yeah, she did. She totally did. Yeah.
So this is where I think it's such a beautiful blend of both this holistic and, sometimes you need a little bit of help. Great.
Yeah. Yeah. Exactly.
That's an amazing story.
Yeah. Yeah. And like so many like that, but it's not just the age. It is, for her, it was already decided. Like even when she came to work with me, she was like, I've already picked out the donor. I'm going to be a solo mom by choice. Like I have some things already set up. But because I'm a solo mom by choice, I need to make sure that I'm healthy enough for my baby, right? Like I need to be at the healthiest possible. And I can tell you that even though every doctor ever has told me that it's normal, I don't think my cycles are normal. So she was bleeding like 10 to 12 days a month. And then she would have like 10 days off and then start bleeding again. So
does that sound
she
in
was
mind?
basically
Who knows
like,
what normal, quote unquote, normal
no,
actually
that,
is?
oh, that is so not normal, right? So I'm talking to her. I'm like, yeah, not normal at all.
Right.
And then we discovered like fibroids this big in her body, like essentially a basketball size of fibroids in her body. They were like, well, we can operate, but if we operate, you may not ever have a child.
Right.
And I was like, okay, so they're not really giving you any options here. So we had to like work on shrinking the fibroids first. We got it down to like a little patty, like a small flat
How
patty.
did you do that?
Oh, it's just like so many herbs, diet, lifestyle. We had a bunch of things that we had to do.
Okay, quick question, and I'm just curious, is what causes fibroids? Because I know when you start this cycle, not realize IVF, they're checking you every cycle for fibroids, right? So does something cause that? I mean,
yeah, it's fibroids are mostly connected to estrogen. So if we have a high estrogen impact in our body, and estrogen can be what our body produces on its own. In IVF, they're checking for it because they're giving you estrogen.
Okay.
And then the other factor, which we don't talk about often enough, is really the estrogen mimicking compounds. So we have things in our environment that mimic estrogen and can have the same impact. So BPA, things in plastic, for example, are a big factor. I've just been diving into research around mold. There's a specific kind of mold. I'm not going to remember the name of it, but specific kind of mold that mimics estrogen as well. Ooh. So we can, the environment is not to be
taken lightly.
Taken lightly. Yeah, exactly. Thank you.
Yeah. I just recently, I mean, not recently, I mean, it's been a while now, but all glass for my son's food, very bottles, all of it for my son. But
good.
The BPAs and then the BPBs or whatever it is. Like
BPS,
I went to another bunch and I was like, we're all checking for BPA and they fixed that. But then they went, oh, do another one. So I was like, you have to be very careful. So I was like, we're glass.
Yeah.
Glass containers. We don't heat plastics. Don't heat plastic bottles and all this because I know it's really disruptive to our system, our endocrine system, right? Specifically.
Yeah. Exactly. Yeah. So they're endocrine disruptors, and when they mimic estrogen, they go and like bind to the same receptors and activate the same things that estrogen would activate.
Wow. So, that's terrifying, right? For breast cancer, right? For all of these different
exactly.
I just know that you mentioned you can get rid of the fibroids. So I was like, if we can get rid of them, then we're doing something to cause them, probably. So
yeah, I think that's part of it. So the last thing that I will mention there is that sometimes our food is also contributing to hormones, in the sense that animal protein is going to have some hormones. It's inherent in the protein.
Even if we're organic, they still have.
Even if they're organic, right? That's the natural,
right?
It's the natural part of an animal. Like we have hormones, so they're floating through, and same thing with animals. But especially when they're non-organic, it's going to have a huge impact on hormones because they're giving estrogen essentially to make the muscles beefier. And then we eat that and we get a huge
all over the place
of estrogen. Yeah. So all of those things are going to contribute to estrogen, which can then grow the fibroids. And then there's some like evidence that there is a genetic component. And then the last piece is really like, are we detoxing that estrogen out of our bodies? So for women with fibroids, for women with PCOS even, sometimes we're not metabolizing those hormones properly and they're building up in a more like inflammatory state. So they essentially have a more negative impact than someone
who can actually metabolize.
Yeah.
That kind of makes sense.
Yeah.
So basically women can come to you to find out actually what's going on to have this blend. That's amazing. I just saw that we've been talking forever now. Do you have time to touch on eggs, like freezing eggs?
Oh yeah, sure. Yeah.
So Dr. Simmons, if we want to, everybody that now I feel like egg freezing is like the thing, right? Everybody knows about it. But what I learned recently is like, even if you do freeze the eggs, that doesn't necessarily mean you're going to have success. And I didn't freeze my own eggs. Kind of wish I did. The more you learn. But is that something that you're seeing more people come to you for? Is there like an age that you recommend? Is this like all women should kind of do this, for preservation?
So I have so many thoughts on egg freezing. I think it's a wonderful tool to have access to. And like, it's beautiful that science has come to a point where we can take eggs, freeze them, and then potentially like have babies later in life, right? So I want to couch this with, I am not against egg freezing, but the questions that I ask to the women that are wanting to freeze their eggs is, well, what quality of eggs are you freezing? And do you understand what quality they are?
Oh, that's a good point. So like you mentioned earlier, hypothetically, if your patient who came into you right away when you said she was 42, you froze her eggs then, they would be completely different than when she went in to do the retrieval after working.
And I would argue that even though she was 2 years older, I can bet you those eggs
higher quality.
Like reversed aging.
Okay. Okay, hold on a second. Is that possible to do that?
Absolutely.
You gotta be kidding me.
So I was saying with the test that came out with the biological age versus chronological age. So if we know that we can measure aging, this lab that's come out with this test is essentially saying, hey, we can not only test it, now we know the things that we need to do to reverse aging. And the founder is a close friend. So she's been public about her story. So when she was 35, she did this aging test. Her ovaries tested at like 40. I may not remember all the ages correctly, but tested at 40. And then she did all of the things that we do in our support system to reverse her age, retested 3 months later. She tested at 32.
Oh my gosh.
So
this is just empowering, right? So her eggs were actually higher quality.
Yes. So if your eggs, basically, if we reversed your ovarian aging, then we impacted the quality of those eggs. There's also a cheaper hack way to test it.
Oh, sorry. No, go ahead, please.
Which is we can test progesterone. So what we do in our practice is we look at the progesterone level 7 days post-ovulation. And generally, progesterone is only looked at for what is the, did you ovulate or not, right? So 7 days post-ovulation, if you're testing progesterone, the cutoff is like above 5, you ovulated. My theory.
And I have that at home. I have that hack using the Prove test.
Oh, yeah.
You can do those at
home. You want to do it in a blood test. Yes, you can use Prove for like proving ovulation. But if we're doing it to test egg quality, we want a blood test.
Okay.
But we're looking at if you understand how progesterone is made, which is the shell of the egg that was released in that cycle is left behind. It's called the corpus luteum. It's what makes the progesterone for the 2 weeks or the first 3 months of life. If that progesterone is high, it means that corpus luteum is really healthy and it's doing its job to make progesterone. And if it's low, then it's not doing a great job. So what we've seen in the women that we work with is we may start out with a progesterone level of 7 or 10, 7 days post-ovulation. And by the time we finish our work, they're at 15, 20, 23. And that shows us like, hey, we've significantly impacted your egg quality because the progesterone production is better, and we're relating progesterone production to health of the corpus luteum, health of the egg.
And the conventional side, they'll just give you progesterone pills to support.
Yeah.
Versus, hey, let's figure out if we're actually having healthy eggs.
Right. Yeah. So the biggest question is, what's the health of the eggs when you freeze them? And
that's a great question.
If we have 3 to 4 months usually before egg freezing, we have the capacity to really impact egg quality in a big way. So that even if you're freezing your eggs at 38, which is not necessarily what they would recommend, but if you're at 38 and you're like, hey, I found the funds, I want to freeze my eggs.
Right, so expensive.
I may not, I still don't have a man. I want to freeze them till I'm ready.
You better make sure you're putting away good ones.
Yeah, exactly. So then at 38, we spend the 3 to 4 months to do whatever we can to support egg quality, get it to optimal before freezing eggs. That gives this woman a better chance of success than,
and when it comes out to be fertilized. Yeah, it makes a lot of sense.
And then the other piece is really, what are you doing in between freezing your eggs and getting pregnant? And it would be like, if I have car insurance, that doesn't mean I go and drive crazy.
That's right.
Right? Like, but a lot of women consider freezing their eggs as like the insurance policy that allows them to continue living their crazy lifestyle, which is still detrimental. Like the health of your uterus is still very much impacting whether or not you're going to go and have a baby at 42.
Well, I'm still just blown away that you can actually reverse this at all, because they're like, you have your eggs when you're born, so there's nothing you can do.
Well, you have your eggs when you're born, except they're in the primordial state. And every month, a few of them are developing into eggs. So we have what we have. We can't grow the number of follicles that you have. But we see this when a lot of women are like, hey, my AMH went up. We have a woman in England actually right now whose AMH went from 0.4 to 0.8, which is a huge difference. It puts her in a totally different ballpark.
And can you just tell everybody, can you tell our listeners what AMH is?
Yes, sure. So AMH is anti-Müllerian hormone, and that's the hormone that is basically like a estimated measure of how many eggs you have in your ovaries.
The ovarian reserve, right? Which,
yeah. So it's a good test to have, but it's not the thing where we hang our hat on, right? So it's, again, AMH is just like age. It's just a number.
But how did it go up? This is amazing. Right? Because on the conventional side, they'll say, you're old, you're done, your AMH is low, we're out, you have no
We're
hope.
done. Yeah.
So for you to come in and say, you have hope, you have these tests, you have the power, and you can reverse this, I'm speechless. Okay. I'm speechless.
Yeah, it's pretty wild, I guess, when I see it every day. So
so you're just not, I get it. And I get people like, why are you so acting like you don't know this exists? But no, I did not know that you can increase your AMH. So I'm blown away. So how?
We've been working with her for 5 months. So most of the time we work with women in 4 to 6 months, right? Like we want enough time to really like impact what's happening in her body. For her, she was being exposed to mold, which is a huge factor. Like it's showing up everywhere. So mold is a big factor. We had to get rid of toxins. We had to optimize her lifestyle. She was probably not eating enough calories, believe it or not. So there was a few things for her that were massively impacting what her ovaries were doing. And we didn't magically create more eggs, right? So we're not at all saying that we're magic.
Right? Of course. I know. You're like, no, this is actual science.
Yeah. So we have what we have. But my theory is that the primordial follicles just become kind of go in a sleep state and stop being detectable when we don't have the right nutrients, the right blood flow, the right environment to create healthy eggs. So our body just goes, let's just turn that down. Like, let's just shut it off. Let's take a nap. Let's go into hibernation mode.
Do your ovaries go into hibernation, do you think, as well?
Not fully, but I think like part of it is going into hibernation, right? Like the primordial follicles are like, I don't need energy because I'm not really trying to have a baby. I'm just going to shut it down. So these follicles stop being detectable. And then we give it the right nutrients. We give it the right blood flow. We restore optimal fertile state. And the body goes, whoop, let's wake up. I'm back. So we haven't done like anything magical. It's really just what the body has. And we're constantly detecting whether or not we should be in a fertile procreative state or a survival state. And if we
stress, is stress the only thing? Stress and food, right?
Stress, food, toxins.
Okay, the 3 factors.
Right? Yeah. Okay. Like those are the big ones. There are probably other factors like nutrients. Are we absorbing nutrients? Is our body inflamed? They're like those types of subtle things are having a constant role in whether or not we're in survival mode or we're in reproductive mode. And we can only have one of those.
Yeah. And you know what's interesting about my journey, and I'll just share this with all of our listeners. And so, you know, I'm going through the IUIs right now. And so for the past 2 sessions, my left side hasn't done anything. Okay, for 2 times. I had to take a break for 2 weeks. I come back, I have both sides are like full blown, more follicles than ever. And I'm just like, what? I thought my left side was done, you know, AMH. So, but all of a sudden it came back. So I can see how based on lifestyle or food or stress, we had a big family stress event going on, massive deployment situations, right? The whole thing caused a lot of stress. Like, how are we going to do this? Like raise a baby, husband's gone. And then in trying to have a baby. So my stress was through the roof. And I wonder if that just kind of lowered everything.
Yep. Your body's like, this is not the time to make a baby. So let's conserve our resources, put resources where we need them, right?
Interesting.
And you can get those resources reverted back to the ovaries, but it's not a fixed scenario, right? A lot of people are like, just tell me what supplements to take and I'll take them. I'm like, it's not as simple as what supplements to take. It's
here's your checklist, like, baby, right? Here's your checklist this month.
Right. Yeah. It's not something that you're just ticking off the list. It's really like we all have stress, and then we have extra stressors that you were just talking about, like the acute stressors that just pop out of nowhere, and you're like, oh shit, I got to deal with this.
Yep.
And those are all perfect scenarios for the ovaries to just be like, yep, let's chill out. We don't need to expend energy. And we have our personality stressors. And those are the internal things that are how we perceive the stress that's happening in our world, right? Is this happening to me or for me? And those are the things that we have control over. So those are the things that we're often helping women shift. Yeah.
Wow.
Yeah. Like, how are we perceiving what's in our world, what's in our reality? Even things like allergies or mold, our body can perceive it as a stressor, and it can respond to it like, I need to fight this thing. Or it can like find a way to adapt and become at peace with the environment. And I'm not saying to live in a moldy environment, but
of course, we're just saying that your perception on what is going on can actually affect your reality of we don't need to be in fight or flight. And that's interesting you bring that up, because it's just kind of like with that IVF journey and we were discussing earlier. It's like, it's really going to stress some people out. And sometimes it doesn't stress other people out. I mean, it really depends on your mentality going into these different scenarios, like what's happening around you and how you perceive it and how your body's going to react. Interesting.
Yeah. So all of that plays a role in whether or not a woman or a couple is reaching their optimal fertile state, or if they're moving away from that fertile state.
Are there any Before we wrap up, are there any like tips, right? We talked about a lot with optimizing fertility, and we talked about the 3 factors. Are there anything else? We talked about acupuncture for a minute. Is there anything else we should be? I feel like we kind of covered them all.
We covered
We covered a lot.
I always get asked about supplements, so I will say like there are lots of supplements out there.
I'm on so many myself right now. So give me the list. What do we?
Yeah. Well, I feel like personalizing supplements is the way to go, because really you could take 50, 100 supplements and still feel like, wait, what's this other thing I'm hearing about, right? Like it's never enough. But
I feel like I have supplement fatigue, to be honest.
Right.
If that's a thing. I don't know if it's a thing.
No, that's a thing. That's totally a thing. And
I'm
like
actually sick of choking them down every day. I'm just kind of like, can I just have a day off?
yes, take a day off, please.
I'll see them lying around. I'll leave them around the house. It's a lot. But yes, let's hear. Of course,
so really personalize your supplements, right? So again, testing first and then figuring out what goes with it. But some of the big ones that I prefer would be things like glutathione, phosphatidylcholine, acetyl L-carnitine. Those are what we find are often deficient in women. The things that are often not deficient are things like CoQ10, which either they're already taking and they don't need any more of, or their body's not even responding to what they're taking.
I think there was a my CoQ10. I think there was even a limit, like take this for 6 months and then stop. And I'm like, well, when do you start taking it again? It could have been a different one, but yes, CoQ10, vitamin D's.
Vitamin D is a really good one, actually. Vitamin D, so many people are deficient in.
Mm-hmm.
So measuring and figuring out your right dose is what I think is a good strategy over like, let's just supplement everything. And then you get to the point of like, I take 50 pills a day. What am I even taking? Why am I taking these things? So yeah, really like find the ones that are really helpful for you.
Yeah. And then there's another one like something methyl by Thorne. And it was
methylfolate.
Maybe, but it was like, this is to help the methylation in your body to absorb the vitamin D. So then it's like, now you're taking pills just to make your other pills more, more active.
Yeah.
So this just sounds like all the women need consults with. And so speaking of, right, so we love this holistic. So, obviously people can't book with you for any reason. Can we go to any holistic fertility specialist? Is there, are they, I'm sure they're different across the board. What would you look for?
Yeah, they're not all the same.
Right.
So I would really ask if they have a personalized approach. There's like a lot of stuff happening in the fertility space that I see, which is so many practitioners are coaches that are doing more like mindset coaching around fertility. And again, like we do mindset coaching, we don't have a problem with it, but it's very different from going to someone who's like actually trying to address and assess your underlying root causes, what's happening in your body. Can we really understand it and support you according to what your body's needs are? So my approach would be really to ask like, how individualized is your process? If it's a group program, it's probably not that individualized, right? And like they can't individualize stuff in a group setting. So really like find out what it is that they're doing, signing up for.
Yeah, because like if you're calling the naturopathic docs, right, you're probably getting an office manager. So, it's like, what can you ask the office manager about would you just ask like, what is your fertility protocol?
Yeah. Or like, how do you work with people? Is it a group? Is it one-on-one? And then like look for a fertility specialist. I think that's the other big one is like, if they're not specialized in fertility, we have one couple who is so interesting. They're relatively young. They bought my like DIY course, and they bought it in like December, and then in February came back after doing all of the testing with other naturopathic doctors. They're like, we did this test with this naturopath and this test with this naturopathic doctor. And like, we got these interpretations. We've been trying this stuff out. It doesn't feel like it's doing anything. What the heck? And I'm like, well, first of all, why didn't you just get the test from us? I'm very confused.
They tried to
like
save
they
money.
paid so much money to like go to these different doctors and get all these different tests. So all good. So they come to us, we put all of their stuff together and like break down exactly what's happening and the process in which we should like go about getting to that fertile state. And they were like, oh my God, it actually all fits together. It's not this like one thing over here, one thing over here, one thing over here. It's a process, right? Like you really have
Which is
to
the
think
holistic
about
process in general. Like
right.
we all have, in our conventional system is like, okay, this system and this system, nobody's putting it together, which is why the functional and integrative and holistic exists.
Yes,
So
that's why
people
it's
are finally
holistic.
getting there.
Yeah. So really like put the pieces together from the perspective of fertility. It's not just like, is this normal or is this healthy or even optimal, right?
Like you mentioned your genius, this kind of discovery on blood sugar and the effects. Like you'd be like, okay, well, you're in range, but that could still be, well, what range is actually healthy? Like, okay, well, it's still a little bit high, but it's still in range. Okay, you don't have diabetes yet, but you could be in the pre-diabetic range and it still could be massively affecting that fertility, like you said.
Yeah. Yeah. Yep, totally. So really like having a fertility focused specialist, you can tell from a person's website, right? You go to their website, if they're talking about, we can help you with fertility and multiple sclerosis and autoimmune thyroid, and like, it's just so broad. They're not focused enough on fertility. And that's okay. Like they can be good preconception support, but they're not a specialist that's going to help you like figure some things out and put together a picture that is going to support you if you've already been struggling for a while.
Right.
So it's the preconception stuff is great for someone who's not trying yet, who is just starting out on their journey.
Kind of
like,
oh,
I just need a little bit of support. Yeah. So yeah, I think there's a lot out there that is accessible. The other thing I will point people to is I just started a startup that is launching in like, we're in the soft launch phase. So we're there, which is basically taking all of my like analytical side and putting it into tech. So we created an analysis that is the root cause analysis. It's the question of how do I figure out what could be happening under the surface? Yes, I can do tons of tests and all of that.
Somebody's got to put it together.
Right. Someone's got to put it together. And I don't maybe have the resources to do all of these tests.
Exactly.
So you can go to analysis.madrefertility.com. I'll send you the link.
Okay.
And it's a questionnaire. So you fill out the questions. It'll walk you through like which paths we need to know more about and all of that. Like the tech is beautiful. So at the end of it, it gives you like the top 3 things that are making it hard for you to conceive on your journey. And like, could the analyzer be wrong? Yes. It's a tech tool.
Natural
it's a tool.
Could any go to any physician? Could they not connect the dots? Sure. Right. Yeah. I mean, I'm just saying there's always going to be that, it's not 100% right all the time.
Right. Exactly. It's not 100% all the time, but our preliminary testing, we've put like 100 people through it so far. And like the people that I already know that have lab results, we've compared, and I'm like, oh my God, this is exactly what I told you.
So it's better than WebMD, right? Better than going to Google yourself. Okay, cool. Okay, that's a good start.
Don't Google your symptoms and try to figure it out. Yeah.
Here's my blood work results. What do I have? And yeah. Okay. Well, and I make it better than day.
Yeah. Yeah. Totally. It'll be a good tool to at least get started for people of like, what's going on? I don't know who I should talk to. I don't know where I can talk to somebody. Like, I just figured like we create a tool that people can have access to that is way easier.
Yeah. And, ultimately, what's really sad too is even if I got off right now and I messaged my primary care provider and I asked for these tests, I would just get a message back that says, why do you want these? Yeah. Anything. Why do you want these? You're fine. You don't need anything.
Mm-hmm.
It's just, that's the sad reality. But the tech is amazing. And thank you for what you do and for doing that. And before I keep you for any longer, we do ask all of our guests a question before they leave us. And that is, can you share 3 fundamental pillars that contribute to your well-being?
Yeah, totally. So one is sleep. And I'm really, really diligent about making sure that I get enough sleep and that I try to protect the sleep-wake cycles. So we, like another thing we could dive into, but really like making sure no screens an hour or two before bed and getting sunlight first thing in the morning is going to help that cortisol melatonin balance, which is so crucial to fertility and egg quality and so many things. So that one is a really big one. Exercise, of course, is the big one. And I like to exercise with my cycle. So really like empowering our hormones through exercise rather than like exercising our way to like compensate for all the things. And then the last one is just good high quality food. So making sure that I try to get a variety. 30 different plant foods per week is a good goal to have.
Oh, cool.
To make sure that you get a different array of antioxidants from all of these different plants.
Oh, I love that. And then you also mentioned the nutrition, the nutrient testing. So all the tests you mentioned, all the information, we're going to link all of this in the show notes. But Aumatma, can you please tell us where our listeners can connect with you, where they can find you, and how they can sign up to be part of your program? And I believe you gave our listeners a special discount as well. So can you tell them a little bit about that?
Yeah. I don't know what the discount is. We have, so the easiest way to connect is at Holistic Fertility Doctor on Instagram. We have the same account on TikTok, but don't message me there. So at Holistic Fertility Doctor, we're really, really easy to connect with and chat with on Instagram.
Okay, and I think we'll put this in the show notes, but it looks like we have coupon code and it says Blueprint 2. Blueprint has exact tests you need.
Oh, cool. Yeah. So the Blueprint is essentially like it will lay out all of the different tests that you could do and what they would help highlight or tell you about your fertility journey. So,
but for all of our listeners, don't be discouraged. If you can test it, you can probably try to reverse it as she just told us. So don't freak out.
Yeah. Do not freak out. A lot of people do.
Yeah, I'm so excited about this AMH situation and testing now. Yeah. I'm just so much more empowered personally, and I hope all of our listeners are too. It's incredible.
Good. I'm glad to hear it.
Well, thank you so much for being here. Thank you so much for all this wonderful information and talking about all the things fertility. I appreciate it.
Thanks for having me, Riley.
Thanks so much for listening. This has been Sofia Unfiltered, a podcast by Sofia Health, the #1 marketplace for health and wellness. Find services, classes, and products from the top health and wellness providers. Book an appointment or join live classes now. I'm your host, Riley Rees. If this episode resonated with you, we'd love to hear about it in the comments section of your favorite podcast provider or with a 5-star rating. Let us know what your biggest takeaway from this episode was, or share it with someone you hope to inspire. Join us again next time for more real conversations, stories, and insights that help empower you with the knowledge and inspiration needed to transform how we care for ourselves.